Hi, everyone. Good afternoon, and welcome to this webinar on getting started with healthcare climate resilience. My name is Helena Uhl, and I'm the Climate Communications Officer at Healthcare Without Harm Europe. I'm stepping in last minute to moderate the session as Maria Figueras couldn't join us, but hopefully that's okay. First of all, thank you to everyone for joining us today. We have a very exciting agenda ahead. So during this webinar, we will look at how we can ensure that the European healthcare sector is resilient to the impacts of climate change. We'll be joined by speakers from across Europe currently working on this topic. Our changing climate and the rising frequency of extreme weather events have very serious implications on our health systems. Hospitals and healthcare systems are affected operationally, functionally, and structurally by climate change. Not only that, climate change also directly impacts the health of our patients and communities. Current climate change adaptation strategies tend to focus primarily on enhancing the resilience of critical infrastructures. So for example, energy, transport, and buildings, but they tend to overlook the healthcare sector and its dependency on those vital infrastructures. Therefore, today, we'll be talking about how we can address those gaps and ensure that European healthcare systems are resilient to climate change. So just to give a quick overview of the agenda for today, we will have 4 presentations followed by a short Q&A session. Firstly, you'll receive an introduction to our LIFE RESYSTAL project from Stelios Kirosis, Associate Researcher at the National Center for Scientific Research, Democritus. He'll be outlining how this project will improve climate resilience of healthcare facilities and health systems by developing a framework for climate resilient health systems. This includes tools and methodologies for health facilities, develop preparedness plans, but also implement blue and green infrastructure measures on the ground. Our next presentation will give you a more detailed look at one specific aspect of the LIFE RESYSTAL project, so its community approach to healthcare resilience. Cyprien Brutin, project manager on climate tutorial resilience at Actera, will explain to you how this project is mobilizing stakeholders from across local communities to ensure that not only hospitals are prepared for the impacts of climate change, but also the critical infrastructures that they depend on to function. Then, on a more practical level, you'll hear from Sebastian Coquelin, Director of Financial Affairs at CHMO and Center Freak, about his experiences building climate resilience on the ground at his hospital. So basically, a more practical view of how this is all looking on the ground. Last but not least, you'll hear about our European Network for Healthcare Climate Resilience. Although Maria Figueras, Climate Officer at Healthcare Without Harm Europe, couldn't join us today in person, she did prepare a video that will introduce you to the network and also give you an overview of the benefits of joining. So last bits of housekeeping before I hand over to the speakers. If you have any questions for the speakers along the way, please add them to the Q&A tab at the bottom of your screen. We'll be keeping an eye on those questions and make time to answer them at the end. If the question is aimed at a particular speaker, please do indicate that, and we will make sure that we aim it at the right speaker. And finally, we'll be recording the session and it will be made available to all participants via email later in the next couple of weeks. So now, without further ado, I'll hand over to the first speaker. Stelios, please go ahead and give an overview of the LIFE RESYSTAL project.
Hello from my side. Give me a minute to share my screen. Okay, I think it works. So, I'm Stelios Karos, as Helena said. I'm working at Democritus in Greece. I'm the technical coordinator of the project, which is a LIFE project, a close-to-market project. For those that they don't know, close-to-market project essentially means that the technical solutions are there, so from the technical partners. So in this project, we try to adapt the technical solution to a specific sector, the health sector, and make them all work together. And provide some a holistic framework for the health system to be more resilient in climate change. The project is a 4-year project from the September of 2021 to August 2025. The partners come from 6 countries: Belgium, France, Greece, Italy, United Kingdom, and Spain. The budget of the project is something more than 5 million, with the European Commission co-funding up to 55%. LIFE RESYSTAL it's an abbreviation, comes from Climate Change Resilience Framework for the Health System and Hospitals. The consortium, the partners of the consortium can be categorized in 2 groups. The technical partners, Dimokritos, which is the coordinator of the project, comes from Greece, University of Cambridge from UK, Actera and Kaisoft from France, Rina Consulting from Italy, and last but not least, Healthcare Without Harm from Belgium. Also, we have in the consortium 4 organizations that represents 7 pilot hospitals where we test our tools and implement some green and blue adaptation measures, which is Podbari from Italy, Sergas from Spain, CHBLO from France, and NHOSP from Greece. So now the objectives of the project, of LIFE RESYSTAL project. Basically, we try to, with our solutions, our approach, our methodology, we try to increase the climate adaptation capacity resilience of EU health infrastructures, but not only provide some tools, but also test innovation solution in 7 pilot hospitals across Europe. Also, in this whole framework, complementary but equally important is for us and for the project is the people engagement. Engage the stakeholders, the policymakers, the health care personnel via local community of practice, which is something that you'll hear more from the next presentation. What we envision the scope of the project is to tackle climate change adaptation in EU health infrastructure, but also find and address gaps in climate resilience. In the end, we think that this will pave the way for better assessment of health system climate vulnerability. In addition, we try to see the hospital in our analysis not only as the physical infrastructure, but also finding the dependencies between the hospital itself and the services that it provides. So provide some analysis more in a holistic way, operational and infrastructure, and complement this by providing a better tool for better investment decision for the policymaker, for the hospital managers to encourage climate change adaptation. And as I said before, all this will be tested in 7 pilot hospitals in different European countries. Here you can see some impacts of LIFE project, what we expect to achieve through our solutions, through our implementation measures. This can be categorized in 3 groups: the improvement of adaptation, the resilience of health facilities and operation, the upscale adaptation initiatives in health system, which basically it's important for us and basically tackles 2 things. One is transferability and replicability of our tools and methodologies, plus go beyond the local scale, the one hospital, to the regional scale. And the 3rd group is co-benefits in climate change adaptation in the health sector. LIFE RESYSTAL project has some policy implications. We want to contribute in the development of implementation in union policy in climate adaptation. contribute in a knowledge base for the development of assessment, monitoring, evaluation, and implementation of effective climate adaptation. And something that it's very important for the project and for us is to provide some insights for strategic planning and action planning in a two-level governance, local and national. Also, our ultimate goal is our approach to be easy to replicate and transfer beyond LIFE RESYSTAL to other hospitals across Europe and even to system level that it's the coordination and between different hospitals in the same region. Here you can see in the figure the different parts that comprise the solution, the framework of LIFE RESYSTAL. Is first of all is as I said before, is stakeholder engagement. This is something that is creating in a local scale, in a pilot scale, and we gain feedback for customized, let's say, our solution in the specific country and hospital. Then we have the toolbox, a different set of tools that we help the hospital manager, the user in the end, to take decision in and assess their infrastructure, how resilient is in climate change, and take some decision to make it more resilient. Then we have the implementation measure in 7 pilot hospitals: France, Spain, Italy, and Greece. And in the end, we will provide an upscale adaptation package, how to go beyond the 7 pilot hospitals that we test our solutions. The latter is something that we give an extra effort, and we inspire to create a scaling network and set the base for a European network for the climate adaptation. Also, as I said, we provide an upscale adaptation starting package to facilitate that, and also a best practice guide for the system level adaptation, as we focus mainly the project in the hospital level, but try to set the baseline for our approach to make it easier to go to the system level adaptation. Thanks for listening, and I give the floor to Elena.
Thank you so much, Stelios. So for the next presentation, we have Cyprian, who will talk a little bit about the community approach that the project takes to climate resilience. Go ahead, Cyprian.
All right. Share my screen. Can you see it well?
Yes, perfect. Thank you, Cyprian.
All right. So good morning, good afternoon, everyone. And so thank you, Helena and the Healthcare Without Harm team for inviting me to speak. So I will present you today some of the key results of the LIFE RESYSTAL project. So I'll focus first on the experience of establishing communities of practice for climate resilient healthcare facilities. So we have conducted this work on the 4 pilot hospitals that are benefiting from our support. I will then, towards the end, talk about the replication guide, which is a document that we have produced. It's still work in progress, but which is based on the experience that we had establishing community of practice, and that will help hospitals, other hospitals replicate this experience and will be part of the upscaling adaptation starter package that Stelios has already mentioned. So first, just a couple of definitions. A community practice, what is it? It's an exchange platform where contributors of the community share their knowledge, their personal and professional experience on climate change and health challenge, in this case, and solutions. So the idea, so it can be also called a working group, for instance. Here we use the term community of practice. The idea was to engage stakeholders from the hospitals, but also beyond, as Helena mentioned, from any critical infrastructure that the hospital has to rely on in terms of utilities, electricity, water, heating system, but also climate authorities, local authorities that can help, can contribute to the resilience of the hospital, to build a collective climate resilient pathway for the hospital. The specific objectives of this community of practice in this case were to facilitate the collection of data by technical partners. The objective of this collection was to help them analyze and assess their climate risks, and also design collectively their adaptation pathways. I will come back to that after in the next slides. Ensure that the project deliverable and tools created respond to the needs of the hospital. Also monitor the progress of the hospital's adaptation process, and ensure the engagement of all local stakeholders. When we designed this community of practice, we had in mind 3 main thematic areas. One was on governance, so we gather all actors that can contribute to a better governance of the hospital itself, but also the hospital and other actors of the health system and other actors of the territory that can contribute to its resilience. The second aspect was crisis management. So we gathered all actors involved in the crisis management in the territory. And the last one was infrastructure. So in this case, and building, and in this case, we gather actors that were working in this field. And the idea was to have a transversal contribution from climate partners. We designed an incremental approach for community buildings with 3 main steps. One was raising awareness. So that was the first step. The idea was to have a first meeting to help actors, stakeholders of the community of practice have a shared understanding of why we are establishing this COP and what is its objective. Institutional mapping, the objective was to map all the different actors to make sure that they are all on board, or at least informed about our initiative. And the last one was a resilience capacity assessment, which was in the form of a survey to quickly assess basically what are the main issues at stake. One tool that we used to ensure and support the COP engagement framework was what we call the Community Engagement Charter. So this is a non-binding document that each COP member was to review and sign. Here, there's a slide about the stakeholder matrices. So what we did in the second step that I just mentioned of the COP establishment process, we try to map by using this diagram the stakeholders at stake. So here we distinguish between public and private stakeholders, and whether they are within the hospital, within the health system, or at the territorial scale, and also what is their role. Do they have a decision-making role, an operational role, an advisory role? So with this, the objective was to map as many stakeholders as possible. Results of the COP kickoff meetings. So here, basically, we have organized many meetings. So I just wanted to mention that we had quite a few participants. We organized 4 meetings of the COPs, sorry. With the 4 pilot hospitals, they were in France, in the south of France, in Millau and Saint-Afrique. Sébastien Coquelin, who is today present and speaking, could say a few words about that. In Greece, we have the hospital of Nicaea. Stelios also was heavily involved in this process, so he could say a few words about them. And in Spain, we have the hospital Galician Health Service with 3 hospitals in the cities of Ourense, Berin, and Oberco de Valdeorras. And finally, we have 1 hospital in Italy participating to the Resystal project, which is in Bari. This is just to give you an idea of the assessment survey. So we had 1 survey, it's a big table with which we designed this radar diagram, where you have the different dimensions of resilience: leadership, governance of data, buildings, green infrastructure, utilities, access to the hospital, and emergency preparedness. This has helped to assess the right, to have a first idea of where the hospitals stand. Finally, we have proposed basically a roadmap to the hospitals, telling them, so you have 4 years, the project is 4 years. During the first year, the objective will be for you to review the methodology and adaptation for approach for adaptation planning in your hospitals. And we can support you also by training and raising awareness of your staff. This is what we've done during the interviews that were conducted during the interviews and also the kickoff meetings of the community of practice. The second year is to conduct a climate risk assessment and identify relevant adaptation options. The third year is to conduct an adaptation pathway process and determine the action plan. And the last year will be to start implementing adaptation measure linked to the adaptation plan. And we designed also, we propose to have meetings every 6 months to, as I mentioned at the beginning, by presenting the community of practice, to monitor the progress of the hospital adaptation process. Finally, so all of this experience that I just presented, we have put it in what we call the community approach replication guide. So the objective is to summarize basically our experience, to provide a methodology to establish a local community of practice. This document will target future replicators of the LIFE RESYSTAL scale project. So mainly members of what is called the scaling network, but more broadly could concern any European healthcare facilities or even beyond, maybe healthcare facilities outside Europe. And this guide comprises 2 main sections. First, a presentation of the steps to establish the community of practice, including a timeline and a draft agenda, and then an annex that includes material to support the community setup. Finally, I would like to mention that the draft version was submitted last August. It is still to be reviewed by the LIFE RESYSTAL Facilitation Board, which is an advisory board supporting us in the drafting of the deliverables. After that, it will be published and will be part of the, as I mentioned, of the upscaling adaptation starter package of the LIFE RESYSTAL project. So thank you for your attention. I will be more than happy to answer all your questions. Thank you.
Thank you so much, Cyprien. So it's great that we now have an overview of the more abstract sides of the project and to get a better understanding of the project. What's next is a more practical look at how what that's actually like in the healthcare sector. So Sébastien will be talking a little bit about his experience on the ground at CHMU implementing this project. So go ahead, Sébastien.
Hello, everyone. Thank you for this meeting. Do you see my screen?
Yes, it's currently not full screen though.
Is it sorry? Yeah, I will put it in. Yeah. Is it all right with you guys?
We're currently seeing the backside back end for you, so maybe you can switch the two screens.
It's not the right screen, you say?
No.
All right. Give me a sec. Yes, it's bizarre. Okay, now it should be working.
Perfect.
Okay. So, so I'm going to try to share with you guys the experience of on the ground at CH Nimio and South Africa, because we have quite some impacts on the climate change on the hospital function. So basically, our hospitals in the south of France, we have with a Mediterranean climate. The living area hosting about 70,000 inhabitants distributed, in between small towns and countryside. You can see it here. The two hospitals are like 20 kilometers apart, which takes us about half an hour to reach them. And we've been since 2019 in a unique management and administrative function between the two hospitals. When we go back to key figures, you can find that the foundation of the two hospitals are quite old right now, and our buildings are old too. So that's why we this project, the LIFE project, is the LIFE RESYSTAL project, is for us really important, because we believe that we need to invest on our buildings to prepare ourselves for the climate change. So basically, that's why we are tackling this project. And so we are a small hospital in a rural area, and we work with we are in a consortium of 9 hospitals managed by the University Hospital Complex of Montpellier, that you can see here. In order for us to serve a community of nearly 1 million people. This consortium is the 3rd largest French city near the Mediterranean coast. So we work with them so that the knowledge that we are implementing right now with this LIFE RESYSTAL is being helping everyone in this consortium looking towards the future. What we can see that we have 2 main climate hazards concerning this area is the flooding in South Africa. So that's why when we experienced in 2014 a flood that actually something is happening on the screen, but don't worry. So basically, for the flooding, we had to stop the Stork River that you will see on another presentation. The overflow of the building of the Stork River stopped the activity for 6 months. That was a big issue for us. And what about the heat wave in Millau and South Africa? Is that the buildings are not old, so when there is a heat wave, the rooms gets the temperature goes to 30 degrees, and so it's really incompatible with the proper patient care, and it's being really hard for the staff working conditions. So we need to work on that. Even if South Africa is not subject to heat wave, because there is not a science. What we can also see is that, as I was saying, we have already we are planning on we have about more than 100 million euros of investment to do in the 5 to 10 years to go. So that's why we believe that we need to have the knowledge of the LIFE RESYSTAL to be prepared for since we're building a new building. This is Millau, this is South Africa, and we're building a common hospital for the accurate care of medicine, surgery, and obstetric with the emergency. So basically, that's why, and we are trying to rehabilitate the old sites of the hospital we have right now. So basically, there's as I was saying, a lot of investment to do, and we need to be prepared for the climate change that shows on some graphs that we have more heat waves, and sometimes maybe the percentage of flooding could rise. So basically, this is the plan of the buildings. As you can see, Santa Africa Hospital the buildings are all gathered. Whereas Mio Hospital there is many sites within the center of the two cities. This is a really important point, that we are really inside the city area, and even if there are small cities. And what happened during the flood, as you can see, as all this part of the hospital has been flooded. So the activity of those hospitals had to stop. So we'll go back to that afterwards. And the blue circles are the main adaptive measures that we're trying to bring on those buildings to be resilient of the climate change. So this is Santan is one of the buildings that is really in the center of the city. This is one of the buildings that we want to rehabilitate, because with the new hospital, we'll be selling some of our buildings. This one will stay with us, and this is where we are going to focus our energy on adaptive measures. What are the adaptive measures that we'll try to put together during this project is a waterproof mobile installation for the Santa Africa Hospital, green facade, so we can cool the area and the building, Canadian well, so the air can come in and protect. We have air, cooling air that can come at night and in the building, and protect against the sun. This is a big issue too, because we are in the south of France. Let me go back to what we experience right now, because we are an hospital. That means that we work 40 hours. We're always open. There's always light, 7 days per week. So basically, we always have to where we have emergency activities on the two hospitals, even where it's small ones. So we have been tackling the climate change risk on MRI cooling system. Basically, what you can see is that the MRI works with a liquid helium system that needs to be really low. So there is a compressor for it to help with that works with water. So the water needs to be at 10 degrees, and we have all those big installations just for that equipment. Since when we have heat waves, the thing is that outside we have cool groups that help us to get the water and the air, to lower the degrees for the machine to be working. And what we've been experiencing is that during heat waves, sometimes it's being hard for the cold group, the one you see here, that are outside on the roof. So that really looking and the sun and the heat wave is really tackling those equipment. Well, we could have trouble to make this MRI cooling system functioning correctly. That could lead to shut down the system. And if it happens, this liquid helium turns to a gas and goes out with a special security safety system. And then we will see we have to bring other liquid, and we have to turn the machine for quite some for about a week. So basically, that's a big deal for us. When we can also take the example of the laboratory cooling system. As you can see, this is a machine where you make you can have blood samples or other things, so for us to check on the health of the patient. And this is outside the cooling system that makes this machine work. Basically, what we can see is that it takes the air outside, and it brings the hot wave after the system goes on. You can see the outside air coming in, Then you have this refrigerating connection, the one you can see outside, as I was showing you right now. And then it goes into the cooling system where the machine in the laboratory is happening. And when the air is really hot, the system is not always functioning correctly, because most of the most of those system here works until it goes to 42 to 46 degrees. And sometimes when there's a heat wave, the machine is really struggling to cooling down. And this is when, since it's not being, the laboratory is not being refreshed, since the machine is bringing heat into the room, sometimes, we are facing a risk that of a failure. This is basically what I was telling you. So this the equipment, there's equipment heat, there's heat wave. Both are limiting the cooling circuit. So we have sometimes to increase the energy consumption because we have to put extra cooling equipment. It's like a vicious circle, if you want. And so the risk of failure is getting higher. So it's basically it's really important for us, because if we have a breakdown of MRI, for example, because of function of chilled water unit, because it can happen that as ice forms into the magnet, because MRI works with magnet. So and the air treatment doesn't work well, when then maybe we have to stop the MRI for the activity of the MRI, because it needs repair. We need to change the helium liquid, as I was saying to you. And when it gets too hot, when the air treatment is too hot, sometimes we've seen that the quality of the medical images are reducing. So basically, that's a really issue for us. And so the impact on our system, on our hospital system, is that the medical technical platforms, well, when the MRI doesn't work well, or it's just stopped, well, then what we have to reorient the patient in serious condition according to the level of emergency. So we need to call. We have a regulation on this territory, and he needs to take the people and brings them to other hospitals. So this is a big issue when they come to the emergency services. When people are being hospitalized, so they're already in our beds to be taken care of. Well, sometimes we have to transfer, for some patients, we have to transfer them to other hospitals. When we have consultation, when people come in and have a checkup, well, we have to postpone them, because sometimes some consultation needs to have MRI on the side, with a clinic appointment. For the healthcare users, well, it means that we have to extend the deadlines for some of them to be taken care of. And for the health professional, there is a deterioration of care, because their motivation and the sense of work, it's not doing well, or it's not happening, because people are feeling that they cannot do their job correctly, taking care of the population. For the laboratory machine, well, same with the cooling system. It's the air conditioning unit malfunction, or the destruction of certain regions. The things that we put into the blood sample to make examine, to have some results on what we're trying to look for, and they can reach the maximum temperature. So we have also cooling system to protect those regions. And when things are not, if the heat wave goes and impact a lot of, we have to stop the machine. That if we close the laboratory, it's really simple. We have to close almost all the hospital. We have to close the emergency, the maternity, or the operation rooms when we have surgery, intensive care unit. All those things works with a blood sample and laboratory activity. So it's going to be really hard. If we have people in beds and taken care of, well, we have to outsource our activity. We have to bring those samples to others' laboratory. We have to postpone some of our consultation, and then again, health users have to wait, and the health professionals are not really happy because they're not able to have their work. So this is for us a risk that is really tackling the core of our activity. So that's why it's really important to be resilient on climate change and heat wave. I will go quickly on that. It's heat wave impacts elderly in careless retiring home. Basically, for elder people, for old people, it's we have been experienced on one of our retiring home that is located in the Central Africa Hospital, that we have heat waves that really increases the risk of hypothermia on elderly because that sweating disorder, that disrupting of thirst mechanism. And we've been also experienced that the elder people that are in a retirement home have polypathologies that suffer from neurodegenerative disease. And there are sometimes in palliative care, so there are people that are really that risk concerning the health issue. And the heat wave is really, sometimes we know that can kill people. Now we wanted to go back to the flood impacts, because we've been experiencing in 2014 a flood experience in South Africa. As you can see with those pictures that, I mean, because of heavy rain, well, most of almost the half of the hospital have been flooded, at least on the first level. And you can see here on the hospital, this is the retirement. We can see also on the kitchen and the laboratory. I mean, everything was destroyed. And we need to know that this was a big issue for us, because the hospital was almost closed for about 6 months. And you can see as we had to organize during the hours that followed the flood, the transfer of the residents in other hospitals. We had to open department in Mio Hospital to take care of people from South Africa. We had also we could open the building A after about 70 to 80 days. We opened the kitchen after almost 90 days. So basically, we had to. It's been a big impact, and it was really hard for the people that work and for the residents. So climate change and make experience with those impacts of environment issues got to us to stop our activities. So that's why we are really looking forward with this life resistant project to make the right investment for us to take care of people. That's it for me. Thank you.
Thank you so much, Sebastian. Thank you for sharing your experiences of the climate change impacts at your hospital, but also your experience implementing the project. So for the next presentation, just so you're aware, Sebastian, you're still sharing your screen.
Yeah, I know.
Yeah. So for the next presentation, I will be sharing a video that was produced by Maria Figueres about our scaling network. So this is a European network for healthcare climate resilience, which healthcare facilities can join. Just give me a few moments to share this video, and then you'll learn more about the network.
Hello, everyone. My name is Mireia Figueras, and I work as Climate Officer at Healthcare Without Harm Europe. I wanted to start my presentation by apologizing. I am very sorry that I cannot be with you today online. However, I hope that this video will give you all the information that you need to know how to contribute to the LIFE RESYSTAL project and to know how to join the Scaling Network, our European network for healthcare climate resilience. By this point, you already heard about the LIFE RESYSTAL project and the objectives of the project. And one of the important things of LIFE RESYSTAL is that we will produce tools and methodologies that are generalized enough to be used by healthcare providers across Europe. For this, we are creating the Scaling Network, which will have a crucial role in ensuring that the project results will be replicated and used across Europe. This network will be composed by hospital management staff, sustainability experts, representatives of national or regional health systems, federations and networks of hospitals, and healthcare leaders. And by joining this network, you will have different opportunities. For example, you will join a European network that is committed to improving healthcare climate resilience. You will also receive regular project updates during the duration of the project. And you will have access to tools and methodologies that will be produced during the project as well. On the other hand, you will also have access to examples and best practices of climate change resilience projects implemented during and after the end of the project. In terms of what is the role and responsibilities of the scaling network, one of the main roles is to support the uptake of the framework of LIFE RESYSTAL. This will be done in different ways, but for example, we would ask the members to reach out or to help us to reach out to key representatives from hospitals and health systems in Europe. The members of the scaling network will also present the project results at relevant healthcare events to help us promoting the LIFE RESYSTAL project. And they will be also requested to support us in the creation of a guide for future replicators. So this way we can ensure that the framework of the project is flexible and it can be used by any healthcare provider in Europe. Last but not least, the scaling network will also contribute to the project replication by using the project's outputs. So the scaling network members will have a role to use the project results, tools, methodologies, and resources once the project finishes. And that's why it's very important that we try to involve them during the process of creating and developing these tools and resources. In terms of the commitment, there will be ongoing communication with the scaling network members. We will create a group email with all the members of the scaling network, but we have also planned some key meetings during the duration of the project. There are 3 meetings that are already planned and that will be more or less in the dates that you can see on the screen. So September 2023, September 2024, and August 2025. And this will be online workshops to work on different deliverables of the project and to have a space to share the best practices of the project, to make sure that we understand the reality of the different healthcare actors that are part of the network and that will help us to replicate the results of the project. If you are interested to join the scaling network, we will ask you to fill in a survey first. This survey will you will find different questions about your organization and also what have you done so far about climate resilience. After filling in the survey, we will offer you an individual meeting where we will explain you the project in more detail, we will answer any questions, and we will share the membership framework of the scaling network. After this call and sharing the membership framework, you can of course still ask any questions, and then the last step is to sign the membership application form. This is everything from my side. I hope that it made sense and that you get what you need. Anyway, my colleagues will be also available to answer any questions and follow up with you. And we hope that you can join us in this great project to improve climate resilience in the healthcare sector. Thank you very much.
Thank you, everyone. So this maybe also answers a couple of questions that we had in the chat around access to tools and resources. So particularly, some of the project resources will be made available publicly and on the website. However, being part of the scaling network, but also our facilitation board will give you access before these tools become available, and will let you take a sort of consultation role in the project as well. So we'll now be starting our Q&A session. I know we have a couple of questions in the chat. So it'd be great if all the speakers could turn on their videos. And yeah, I'll start directing some questions your way. So I know we had a question from David Brassfield for Stelios around how the upscaling adaptation starting package will be made available after the project ends. Maybe Stelios, you can talk a little bit about that.
Yeah, I'll start, but I see also that you want to take lead on this. Okay. Keep in mind that the project ends at thankfully at the end of August of 2025, but all the results and everything should be sustained for at least the 3 years of the project. For the main outcomes, such as the upscaling starting package, we are planning to make it available on the web, alongside with the toolbox, some part of the toolbox and everything, and create what we envision as a knowledge hub. There is something already there in the LIFE RESYSTAL side, but also we create other things like an online training material, probably the upscaling study package, how to use it will be there also, and everything will be online, and some of them probably are free, available for free to the community.
Great, thank you, Stelios. Then we had a question from Heather around, perhaps also for Stelios actually, around whether or not there will be, or maybe Cyprian can jump in as well, around whether the tools and methodologies will also support, like whether there will be financial implications to support the adaptation measures that will be put in place in hospitals.
Yeah, this is a good opportunity to describe a little bit the technical part of LIFE RESYSTAL framework, which is the toolbox. The idea is to have 4, let's say, kind of grouped outcomes from the toolbox. One is the risk assessment of the hospital. Second is to evaluate the economic losses on the premise that doing nothing, then provides an adaptation pathways and adaptation measure, and evaluate them also financially. So we have a baseline comparison based on the financial aspect. So help the hospital managers to take a decision on doing nothing or do something. That's the main idea, plus provide some tool for the crisis management from CrisisSoft. So answering the question, yes, we are planning to provide measures and some kind of cost to help the hospitals take decisions.
Great, thank you, Stelios. And then there was a question from Gilliam around, is the project focusing on hospitals as an anchor in the territory health systems? So maybe this is the question for Cyprian a little bit around the hospital's role in the community or in the communities of practice.
Yeah, sorry, I'm rereading the question. Yeah, so we are focusing actually on the health facilities and where we are considering the health system or the territory. It's always in relation to the health facility. So actually we are working on 4 hospitals with 4 pilot hospitals, but we consider that the tool that we're developing, they could also be applied to other kinds of health care facilities, like pension homes, for instance, or private clinics, etc. Does that answer the question?
Yeah, I think so. Thank you, Cyprian.
Yeah.
And then maybe a question for Sebastian from David Brassfield around whether you could compare a little bit the economic loss that you had from the flooding at Sanefrik with the potential costs of these adaptation measures, and maybe talk a little bit about the balance of how these adaptation measures will support you from an economic perspective in the future.
So I don't remember exactly because I wasn't there when it happened, but what well, we highlighted during this event that we had to repair a lot of the buildings. That was quite something, but that was not the worst. I mean, we followed up on the fact that we had to stop our activities. So we have also the fact that we had to repair, but we had to close a lot of the buildings. And we had to transfer a lot of patients, and this is really hard to. So it's about 1 million. All of it is about €1 million, but it's really hard to know because if you compare to the year before, we can highlight the revenues that we lost, but it's quite something because there was also we had an experience on the management issue because it was really hard for people to. This is some point that doesn't fit with the loss that we could highlight. Is that it's been really hard for the teams to go back and work again. So basically, that's why we work on the technical aspect of this project with the LIFE RESYSTAL, but we're also working with another university in Montpellier that tackles the management issue on crisis to be able to also find out the earning and the loss that we were facing. The assurance helped us a little bit and for the reparation, and we also had a help from the government because it was a special event for us to work in. So yeah, it's about €1 million of impact for us, to put it in a nutshell.
Thank you, Sebastian.
Yeah.
And then a question for Stelios, perhaps. So can you talk a little bit about the different adaptation actions and interventions that will be implemented across the pilot hospitals as part of the LIFE RESYSTAL project? I think this is a question from Emma.
Yeah. The main goal of LIFE RESYSTAL and the call that we submitted the proposal was to test and implement the green and blue adaptation measures. So in this project, we have 6 out of 7 hospitals. All the hospitals will have some green adaptation implementation measures. This goes with planting trees, rewilding the outside area, green facades or roofs, at least in some hospitals. That was the initial idea, but not so much in the blue adaptation measures category. Also, we have an outlier, let's say, in those measures, which is Nikaia Hospital, which will implement a gray adaptation measures to see how this differs as a solution, as a performance compared to all the others. As Nikaia is a classic urban area hospital in a very dense urban grid with no other solutions to implement green and blue adaptation measures other than relocate the hospital to a different area where you can do this, or demolish some buildings and make room for green adaptation measures. That's overall the different measures that we are planning to implement, measure its performance, and see how this goes, and assess if this can be upscaled to and replicate to other EU hospitals.
Great, thank you, Stelios. We had a question about the hospitals participating in the scaling network. So I think Maria gave a brief overview, but before anyone joins the scaling network, So I think there was some question about the details and how much that entails. I think before anyone joins the Cecilia Network, we will set up a call with you and discuss all those things in detail. So we're always happy to do that. So please do get in touch via our website. So just to answer that question quickly. And then I feel like all the questions are for Stelios, but maybe Cyprian can also jump in. So there's a question about how mitigation will be included in this project. So I'm wondering if you can talk a little bit about how like various resilience measures will also tackle mitigation.
Yeah, this is a big discussion. we had similar discussion internally, how we can effectively and concretely separate those adaptation and mitigation, those two things. I think it's the case where in definition it's very clear what it's what, but when you go to in specific sectors and the kind of measures, if you go to implementation, the one goes hand to hand with the other. So the main goal of the project is adaptation, but as I call it, mitigation is part of it. So we don't directly assess mitigation as a measure, but many KPIs we're using the project address mitigation also as adaptation. So that's my idea. I don't know if Cyprian wants to jump in or.
Yeah, I could just complement by saying that actually our focus is resilience and adaptation, but many measures when we are considering a building or a hospital building, they address both. When you're working with the thermal insulation of the building, this will have an effect on adaptation and on mitigation.
Yes, thank you, Cyprian. Maybe a question for Sebastian. I know we talked, maybe this is taking some liberties as the moderator, but I know that Cyprian mentioned that talked a lot about the communities of practice and how that involves engaging the community. So maybe you, Sebastian, can talk a little bit about what your experience was in terms of responses from the various stakeholders that you included in the community of practice, but also from within the staff in your hospitals when it came to engaging them in this project.
Yes. Since we experienced in South Africa the flood, it really touched all the cities was impacted, all the area was impacted. So basically, when we tackle the subject of climate change, everyone starts to be concerned. So that's why when we started to implement the project into our management and our actions, the users came, we worked with the users, and they had a lot of things to say. When I spoke about earlier about the rooms, the heat in the room being during a heat wave being above around 30 degrees, that's a big problem for the family and the residents. So we've been speaking of that, and what is really interesting is that those people are facing the same issues in their homes. So that's why we have also a policy, a local policy, a public policy here in South African Mio. We have what we call a park. It's a regional park that works with helping everyone. I mean, but people that users or even public buildings or private sector to adapt and protect the environment and to adapt to climate change. So there's like a cluster here. I mean, there's many people that we are in a rural area. So many people works with the environment, with fields, with all. And during the hospital, it's really important to know. Right? People that works in hospital knows about it. Our main goal is to have the light always on. When there is a heat wave, we have been experiencing a lot of people that comes in because they've been experiencing health problems that links to the heat wave. So we really need that for the buildings to be standing, being always open. And during heat waves, the risk is for us that the building turns against us and makes our activities more and more difficult. And this is why, since our mission is to work with users, they've been really helpful to work with us and maybe to find some solutions on political, technical, and financial scale. So that's why we're working on them on many of those topics, and they've been really helpful for that.
That's great to hear. Thank you, Sebastian. I think perhaps, yeah, either for Stelios or Cyprian, are risks to the supply chain, so disruptions to the supply chain, also within the scope of the project, or are they addressed in some way?
I was typing to answer this or some similar questions in the chat. The short answer is, thinking what the question means, the short answer is no. But in our impact and vulnerability assessment, we are addressing, or at least gathering information from the side of the hospital management. So we're asking question if it's a disruption point or something like this in our assessment, but not directly making, let's say, a supply chain modeling to see how climate change will affect this sector and subsequently or indirectly this sector, the hospital itself.
Okay, great. Thank you, Stelios. Then another question from Heather, which is looking again, so at the tool, within the tools set out in the project, is there also a contingency for cross-regional support? And the example that she gives is, if there's a climate event in one region, will other health systems have this flexibility step in? So maybe just talk a little bit about that cross-regional support, or whether that's integrated into the project and tools.
In the last consortium, we had the similar discussion, how to try to implement this. We are thinking about it. The goal is somehow to incorporate this indirectly at first, and then address it directly. But yeah, because we're trying to answer also, at least create the baseline to answer questions in climate adaptation in the regional level, in the system level. We'll try to do it for sure.
I guess just to complement what Stelios was saying is that it's the same kind of answer as the last points. I mean, part of the survey, of course, will question the hospitals on whether they have an opportunity to transfer patients and to get support from other hospitals in the same territory. So definitely this is included. Yet when you're considering the hospital, the main focus on the healthcare facility, the main focus is on the buildings of the hospitals, and to assess whether they can sustain, extreme weather events.
Maybe I can say that we've been sharing the first data and the knowledge that we are gathering at that point of the project with the regional health agency that we have here in the south of France. It covers almost all south of France. I mean, from Montpellier, to the two coasts, Mediterranean coast, and the other one, Atlantic coast. And they're really looking forward for this project, because we need to know in a couple of years to come how the system will work with the climate change, meaning that where are we going to invest? Is it a Montpellier complex university hospital that needs to be able to if, for example, Millau and Santa Fe has a lot of trouble, can we transfer them to Montpellier? So, I mean, those tools will be helpful for each hospital, but also for the system itself, because we need to know if, in case of a problem, because when there's a heat wave I mean, all sorts of fronts that we have a Mediterranean climate will be heated. So we need to find a solution in case of that scenario comes. And we've been working on a national scale, on a regional scale, on a local scale in France on that topic. And we're being we are striving to find the right path with the risk to know in case of scenarios where we can transfer people. Because it's going to be on a regional scale when the heat wave will touch not only a hospital, but many hospitals at the same time. So we need to think about that.
Great, thank you so much, Sebastian. So I think we're running out of time for questions, but hopefully we answered a significant portion of them. So thank you everyone for joining us today, and thank you to all the speakers for sharing their insights on healthcare climate resilience. I just want to say that just because we didn't answer your question today doesn't mean that we won't be able to answer your question later on down the line. So please do check out our website and get in touch with us if there was a particular question that you didn't get answered, or you were interested in one of the initiatives that we talked about today. Particularly for those working in healthcare, we're still looking for healthcare facilities to join our scaling network. So if you're interested in that, please do get in touch or just fill in the form that we shared in the chat directly. Once this webinar ends, you'll also be redirected to this form. So you'll be able to find out more about what that looks like, and then we'll be in touch separately to set up a call and discuss that in more detail. So we look forward to hearing from you for the scaling network or with any questions you may still have. And on that note, thank you very much for joining us today and enjoy the rest of your day.